When a family comes to me with a child that has a severe scoliosis, I explain to them the indications for surgery, the complication rates, and the benefits of it. So to start back, scoliosis basically is asymmetrical growth. The front of the spine grows more rapidly than the back of the spine, and the spine simply torques. Why certain individuals get it and other children don't, we're not really clear. We do know that the only conservative measurement we have is bracing, and bracing can be effective in the growing child, but typically not to about 35 degrees. Beyond 35 degrees, studies have not shown to have been very effective. 45 degrees, 50 degrees, we're talking about a curve that is surgical. It's surgical because we're concerned that curve is going to progress during adulthood, typically a degree or two a year. So if we know where that curve is going to end up, we want to treat it when it's most effective. And that's typically at adolescent, and maybe typically when the child's not even in pain yet. The big picture of surgery, and I try to tell the families, is number one, it's a safe procedure. It is not a minor procedure by any means, but it's a safe procedure. It's safe because the complication rate is probably less than 2%. The risk of paralysis or nerve injury, which really scares people, is probably less than 0.5%. We monitor the spinal cord during the procedure, throughout the procedure, and it has made it much more safe of a procedure than that means. Infection, significant bleeding, pretty low risk in a healthy young individual. So a safe procedure. Number two, the surgery is very effective. The procedure can take a 50-degree curve and make it down to 10 or 15 degrees quite routinely at 80% correction. So a very effective procedure. And lastly, it's not a disabling procedure. The instrumentation or implants that we use to correct the spine make the spine stable enough that the child can walk in 2 days. Basically has no limitations in walking, able to sit, stand, and walk right after surgery to their tolerance. There are some restrictions to avoid the procedure failing, such as running or jumping for a period of time or sports activities and things of that nature. But the majority of the activities of activities of daily living, you return to very quickly.